Welcome to Alimentary, the podcast series where you will learn about your amazing body, how it works, and of course why food is so important. We have our store cupboard staples at the end of each episode. We'll also learn more about lifestyle tips and therapies to help you to influence your health in a positive way. Welcome back to Alimentary and thank you for joining me. Now, testosterone is often thought of as a male hormone, but the truth is that it plays a vital role in women's health too, just in different proportions. So that's just one of the hormone-related topics that we're going to explore in this episode. And I'm delighted to be joined by Dr. Diane Mueller. Now, Dr. Diane is a double doctorate naturopathic physician and doctor of acupuncture and Oriental medicine, and she is the founder of My Libido Doc and My Lyme Doc. She is an international speaker whose work supports individuals and couples in rebuilding intimacy, restoring connection, and transforming relationships from the inside out. So please join me in welcoming our guest, Dr. Diane Mueller. Dr. Diane, thanks so much. It's great to be chatting to you today. So thank you for coming on to Alimentary. And I know we're going to focus a little bit. You have lots of information around this whole area of, hormonal health. But today we are kind of focusing a little bit on testosterone because it's not often focused on. We talk a lot about estrogen and progesterone, so it's really helpful to understand how testosterone fits into the whole balance as well. So can I start off by asking you how you would describe the role of testosterone in our overall health for both men and women, even beyond its link to our sexual health?
Yeah, thank you. Testosterone is very, very under talked about. It's true, especially for women, like you mentioned. And its role is pretty widespread. Yes, it does help with libido and sexual health and desire, absolutely. But it actually helps with muscle growth, with longevity, with brain health, and even with building bones. So when we think about strength, when we think about energy, when we think about that ability to go to the gym and put on muscle, which is so linked to things like longevity, testosterone plays a super big role. And while this is known for men oftentimes, the point I want to make for women listening is that testosterone, of any of our sex hormones, estrogen, progesterone, testosterone, we have more testosterone than any of these other hormones as women. So even though we have way less testosterone than men, it is actually still our predominant hormone from our sex hormone list.
That's amazing. Now, it's not something I think that we would expect to hear. So that's very
Totally.
interesting. And of course, men have estrogen as well, so as you say, it's just the proportions and the amounts vary, from men to women. Particularly now, so during periods of hormonal change, so for women, I suppose, particularly around the menopause time, what kind of changes happen to our testosterone levels or what tends to occur for women? And how do these impact things like our mood, our energy, and our libido?
Yeah, there's so many things, right, that can impact testosterone. So we go through changes, obviously, as women at menopause. Men go through midlife changes also in midlife as what we call andropause. But we have to think about other things that can really impact, certainly diet and lifestyle. We actually see our stress hormone cortisol as being one of the big implicators for lowering testosterone for both men and women. So, what's interesting about cortisol too, our stress hormone, which a lot of people think of as like belly fat, and cortisol can put on belly fat for sure in high amounts. But part of the mechanism of how it does that could be also because it causes that testosterone to go down. And testosterone is about keeping us lean, keeping us muscular.
Oh,
And
that's
it's also
interesting.
yeah. And
Mm.
another point that I think is interesting for people to hear is another thing that people don't think about is raising cortisol, but it does, is long sustained cardiovascular exercise. So anytime we're doing our, long jogs or long, bike ride, these types of things where we have that kind of elevation of heart rate for a long period of time, that does raise cortisol in the body. And so while there can still be other health benefits that come from doing those things, we do want to consider if we have low testosterone that the type of exercise we want to do might not be that long-term sustained cardio because it is going to raise that cortisol and then subsequently lower that testosterone.
So would you recommend a mix of exercise, so where you have a lot of strength training, mixed with a little less cardio sometimes?
Well, it sort of depends upon where our hormones are, right?
Okay.
Number one thing is test to see where your hormones are at. And, because these are going to change different points of our life. And I go through also in my book, Want to Want It, that just came out. I go through also a lot of information about what tests to get because a lot of what we're running in conventional medicine is very rudimentary. It's very elementary as far as like teaching us about what's really going in our body. And so a lot can be missed. But when we do really thorough tests, and let's say we see that cortisol is already a little elevated, right? In that scenario, if we're trying to improve testosterone, we might say, hey, we're not going to choose the type of exercise that is going to raise that cortisol even more. So in that case, we might have a tendency to lean more towards that high intensity interval training, strength training, walking for our cardio, and leave out more that sustained moderate intensity cardio like the biking and running.
Mm.
But if we run our test and we're like, yeah, testosterone's looking pretty good, maybe just a little tweak, and cortisol's looking great, it might not be the cortisol that's really impacting testosterone. So in that situation, somebody might choose to still continue to do some of that more sustained cardio if they're enjoying it, because it does obviously have some cardiovascular benefits to it. So it really is just going to be dependent upon person to person and what their labs say.
Of course, so the data gives you the information to be able to move forward.
Always.
Yeah. So obviously, cortisol has such a huge impact on all of our hormones, really. In terms of testosterone and estrogen and progesterone, do they interact in a way that can affect our mood and our libido?
Yeah, I mean, all of them can actually impact our mood. All of the sex hormones have implications on our brain and implications on brain health. So we can absolutely see that. And we also have to remember too that we have methodologies in the body where we take testosterone and we convert it to estrogen. So for some people too, there's this movement of that testosterone over to estrogen, and people can have low testosterone and that higher level of estrogen, which of course can create a lot of mood changes as well. So yes, absolutely, these things do impact our brain. They can impact us in ways of like anxiety and depression, those sorts of things. They actually can change and impact our serotonin receptors and our dopamine receptors. So kind of those happy chemicals we see in the brain that help with anti-anxiety and anti-depression. Those are, kind of natural chemicals. These hormones do actually directly communicate with and can actually, say, dysregulate the serotonin and dopamine cycles. So we absolutely need to work on them for healthy brain and mood health.
Yeah. So would the testosterone be converted to estrogen as our estrogen starts to decline in menopause, for example? Is that why it would convert into estrogen? Because the body's saying, well, we haven't got enough estrogen, so let's change this over, or would there be another reason for it to convert it?
It actually converts on its own. So even in health, there's always going to be a portion. We actually always make our estrogen out of testosterone. So
Okay.
the kind of the pathway is we have cholesterol, and cholesterol turns into something called DHEA. DHEA turns into testosterone, and then testosterone further converts into estrogen. And that's done through that testosterone to estrogen conversion is done by an enzyme called aromatase. So a lot of even like anti-cancer drugs, right? Or I should say anti-estrogen drugs more accurately, are actually working to stop this aromatase enzyme so the testosterone doesn't convert to that estrogen. So in health, we are all converting testosterone to estrogen to make our estrogen. In fact, what's so interesting is just like we think that, and many women don't realize the importance of testosterone for them. Many men don't realize the importance of estrogen for them. And there's been studies that have shown that if men have low estrogen and they're given microdoses of estrogen, right, way less than we would have as women, that the erectile dysfunction actually goes away. So there's been some thought and research that estrogen is actually working together with testosterone to help prevent things like erectile dysfunction in men. So it's like for both men and women, you want these small amounts of these, hormones. So, when we're converting that testosterone to estrogen, there is like health benefits for doing that. There's reasons we do it. But one of the problems happens is when that enzyme starts working too quickly. And one of the major things we see that can cause that increase in that enzyme activity is going to be insulin resistance. So with any sort of blood sugar imbalances, that enzyme upregulates, as we say, which means the enzyme moves faster. And so then you have a faster movement of that testosterone converting to that estrogen and subsequently more estrogen in the body, leading to problems. This can be anything from acne to, PMS for a menstruating woman, to putting on weight, to female types of characteristics and a man, such as, growing what people would call like the man boobs. So any of these things can happen from that conversion that's too much of that testosterone to estrogen.
Oh yes, so that is something that we see where blood sugar imbalances can lead to hormonal imbalances, and you've just explained it beautifully there. Why and how that happens. So I suppose just going back to women and menopause, how can we distinguish whether, I mean, we obviously low libido is one of the symptoms, and it can be a tricky time for relationships, the menopause, and obviously it's not it can go on for a number of years, or the symptoms can go on for a number of years. Obviously, we're in menopause, in postmenopause for forever, but how can we distinguish whether our low libido is driven by hormonal changes, psychological factors, or relationship dynamics? Is that going back to the testing that you talked about?
It's a really important question, Lynn. And it brings me to something that I talk a lot about, which is it's extremely common when I work in one-on-one with people that they are asking me for the root cause being a singular word. And in going on 16 years of being in practice, I have never seen a single person with something chronic going on that there's only one root cause. So when we're saying, okay, well, what's happening with, the diminishment of sex drive and where is it, coming from, something like testosterone or other hormones versus relationships, et cetera, it's almost always going to be. And I would say, hey, probably like 99.9% of the time, there's going to be somebody someday that's going to ruin my batting average, as I say. But for all intents and purposes, almost 100% of the time, they are going to be multiple root causes of this, of the low desire. And it's really common that people will get put on testosterone and they'll be like, wow, my libido's turned back on. I'm feeling awesome. And they feel really good for 3 or 4 weeks. And then all of a sudden they're like back, talking to their doctor and they're saying like, well, it's not working anymore. And it doesn't mean in that scenario the testosterone was not needed, but if there's 10 different root causes that are really causing the low libido issue and you fix one, it's such a change for the body that it gets kind of like this initial boost. But then all of a sudden the body normalizes that because there's 9 other root causes in this example that are really contributing to it. And libido really in the grand scheme of life is a huge sign of balance and vitality because it is something that, especially once we're reaching an age where we are not in the procreation age anymore, at that point, a healthy sex drive is really just about vitality and about connection and about stress reduction, right? Balance of the body that we see can happen from sexual experiences. So we have to have the energy and the reserves to put into that in order to have the drive. So it's a real big indicator of vitality. But a great place I love for people to start. So if people go to my quiz, I have a free quiz at libidoquiz.com. And so it's a really cool quiz you can take because that quiz is focused on the physical root causes. But from a physical side of things, we have to think about sex hormones. We have to think about thyroid. We have to think about stress. We have to think about pelvic floor problems, neurological issues, and then all the things that can cause neurological issues, such as chronic hidden infections and chronic toxins that can cause neurological inflammation. So in that particular quiz, when you take it, then people are not only given a sense of what their top root cause or causes will be, but it also will give them a list of lab tests to ask their doctor about so that people can self-advocate. Because like I said, like most of the tests that people are doing, like the number of times people bring me a thyroid test, for example, and they say, hey doc, I've had my thyroid test and it's fine. And I look at the test and it's like, well, you haven't, this isn't complete. And I run a more thorough test, and sure enough, there's thyroid disorder. It's way too many times that this has happened that I can count. So, that's a really good resource for that. And then, like you mentioned, like we do have to consider for sure interrelational things. We have to consider body shame. We have to consider like how comfortable we are in our own body and how well we are able to communicate. It's interesting. 92% of couples that report having a really healthy sex life with their partner and really are just very happy with their relationship that way, 92% of them talk about it. But most people in their relationships, the majority of people are not talking about it. So it's a huge step to overcome. And something I work a lot with my clients with is how to actually begin to have these conversations.
Oh yeah, the communication is key, isn't it? And especially, I suppose, for long-term couples, they might assume that they know what is going on with the other person, but you have to talk about it and be clear. I presume then that what you're saying is that those lifestyle interventions, improving how we live our day, can actually help our testosterone levels to get back to their ideal levels.
Yeah, exactly. Exactly. I mean, every day we want to think about a wide variety of things, right? From a lifestyle perspective, we want to think about how we're sleeping, right? Less than 6 hours of sleep a night, for example, has been shown to make us insulin resistant for the next 24 hours. So even in somebody that's testing well from a blood sugar perspective, and they're like, okay, well, I don't have blood sugar disorder. If they sleep poorly one night, less than 6 hours, then that next day they're going to be insulin resistant for that day. And remember, insulin resistance is going to create testosterone converting to estrogen at a higher rate. So sleep really does matter. I know it's very cliche to say in many ways. It's like stress is happening. Also very cliche to say. But people keep talking about these things because when it comes down to it, stress and sleep, while they're a cliche, while so many of us are saying this over and over, the fact of the
Mm.
matter is they're so deeply impactful. So exercise, like we talked about, I don't get into when it comes to like lifestyle choices, I don't really agree with the whole thought of like aphrodisiac foods. And I talk about this in my book too, because when we look at like aphrodisiac foods, and that's like foods that are supposed to say turn on the libido, a good example of this is oysters are always on the aphrodisiac food list. And most people that I talk to about oysters have one or two feelings of oysters. It's a very like love hate type of relationship, right? So it's either you're going to love them or you're going to hate them. And there's some people in the middle, but most people are pretty polarized that way. So oysters may have this reputation because they have a high amount of zinc, and we do need zinc to make testosterone. We do need zinc to help testosterone be available to our cells so our cells can use it. So zinc is a very, very important nutrient for testosterone. But if we think about what's going to drive libido, libido is in part really related to the capacity to be present. So, for example, if somebody is touching somebody's body and their mind is thinking about the grocery list and their mind is thinking about all the things to do and they're not present to the touch, it's very hard to get revved up and turned on that way. So really the practice of sex, the practice of intimacy is directly, it's a mindfulness based activity, right? It's directly related to the ability to keep one's mind present on the pleasure. And so to tie that into oysters and food and aphrodisiacs, if somebody is eating an oyster and they're like, oh, I'm doing this because this is supposed to be an aphrodisiac. I just want to get it down my mouth and look, that's not helping them be present in the moment to like enjoying the pleasure, right? They're just trying to get it over with as fast as possible. So it really, in my mind, it's like we want to choose foods that are anti-inflammatory. We definitely want to get the industrial seeds out, our sunflower, our safflower, our canola, because not only have we seen them to be so inflammatory, they can negative impact our hormonal balance. So we definitely want to get those out. But besides that, a lot of what we do diet wise to support testosterone and our hormones is about eating a balanced diet and, making sure we're getting nutrients such as zinc that is so important. Magnesium's another one that's extremely important. So is manganese. So we want to make sure we're getting all of our minerals in and eating a balanced diet. But really, we want to eat a diet that is like it's clean, it's toxin free, it's organic as much as possible because toxins, we do know a lot of toxins will disrupt the hormonal cycle. So we want to get them out as much as possible. And then we want to stay away from foods that are uniquely inflammatory to us. So like, pineapple is a lovely food for somebody. Almonds are lovely foods for some people. Some people are allergic to those things. So it's less about, hey, this food in many ways and more around making sure you're getting your nutrients so you can make your hormones, but then just finding foods that are like, tasteful so that you can enjoy and be present and experience pleasure with your food, but are really fueling your body with what it needs and getting that inflammation out and keeping that toxic load down. And the toxic impact that we see from things like parabens and toxic
Mm.
metals and BPAs and mold, all of these things are so detrimental to our hormonal system. So that's a really important category to get out when we're thinking about what we should be doing lifestyle wise.
So even drinking water out of glass bottles, or if you filter your water, put it into a stainless steel container or a glass bottle instead of too many plastic, drinking out of too many plastic bottles.
A
I mean,
hundred
that's a step.
percent.
Yeah.
Yeah, 100%. And and
Mm.
like people like an important thing to realize, and some people know this, like because BPA's really hit the advertising world, right? Where it's like the word got out that BPA's were bad and harmful. And so then what did plastic companies do? Well, then they started making BPA free plastics. And so what they did to make these BPA free plastics is they started making plastics that have a higher amount of something called a phthalate. And a phthalate, actually, it's just another chemical that helps to make plastic soft. And this is actually more harmful to the body than the BPAs. So, in many ways, if you're getting your BPA free plastics, you might actually be getting worse chemicals than if you were just going with the BPAs. Either way, they're
Mm.
bad. But to your point, it's like, yeah, it's like you stay away from plastics. And just because something says BPA free doesn't mean it's going to be safe for you. So, it's like, I'm not worried about the person that stops at a gas station because they're on a road trip and they forgot to
Mm.
bring a water bottle and you
Of
just got to
course.
get water in, right?
Yeah.
Drink water. But day to day, as far as what you're doing in your lifestyle, the day to day choices when you're at home and you have more control over things, making those types of good quality choices actually can make a big difference.
Exactly. So the phthalates we need to look out for as well in plastic containers. In menopause protocols, obviously estrogen and progesterone feature a lot. Is it ever appropriate for testosterone to be administered as well?
Oh, 100%.
Mm.
I'm 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 45. I'm in perimenopause. Testosterone is saving my life.
Yeah.
I love my testosterone. So yes, I'm a huge advocate. The biggest thing with NA, if we're doing testosterone replacement or our other estrogen and progesterone replacements, is we're testing. We're
Mm.
looking at labs. Another thing I go over in my book that's really helpful. So if you go to wanttowantit.com, another thing I go over in my book is you'll see charts for if you're using this type of hormone replacement therapy, meaning like a pellet or a patch or a cream versus something oral. There's different testing mechanisms that are going to be more accurate for that delivery system. So we definitely want to make sure that we're working with a doctor that knows that and is getting the right test. And when it comes to really looking at these things and looking at hormones, it's really a combination of the test plus symptoms. Because if you're on the right dose of any of these things, like your symptoms should go away. Hot flashes when you're going through perimenopause and menopause, like hot flashes should go away. You should start sleeping better. Your brain should function well again. Any muscle loss that starts to happen, it's like being on testosterone. I can do pull-ups now, so it's like my body is getting stronger at this point in my life because I'm supporting my hormones so much than it even was before. So huge proponent of them. And I don't know how it is in other areas of the world, but like in the United States where I am, testosterone is still not FDA approved for women. So it's an off-label use. So you have to find doctors that know the research are willing to prescribe this. And sadly, right now, pay for it out of pocket since it's not even FDA approved. But there's plenty of data that's coming out that's showing a ton of benefit. And like I said, it's like not just about the muscle and the libido, but we're even seeing that it like with building bone, where estrogen gets like so much press, and it should, because estrogen is very important. But we also see research that combining the estrogen, the progesterone, the testosterone, that all three of those hormones really working together is going to like maximize our bone retention and prevent that bone loss.
Okay. So I see women in clinic who are on HRT,
Yeah.
and so a lot of their symptoms have eased, but motivation is still an issue, you know? So would testosterone help with motivation?
Theoretically, yes. Theoretically, yes. I can't say I've ever put people on testosterone, and my docs in my clinic and I've ever put people on testosterone and seen like huge increases in motivation. So, yes, theoretically, but I haven't personally seen anything that I would say is like super dramatic from that standpoint, honestly.
Okay, so sometimes that can be, again, looking at the big picture, it can be
Yeah.
lifestyle and stress and overwhelm, you know.
I
So
think the
yeah,
overwhelm was a big one. And
overwhelm.
it's just
Yeah.
like the way we are approaching that, most of us are trained to approach our days in our modern society. It's like it's so much about like tasking and checking things off the list, right? And checking things off the list gives like a dopamine response to the brain. So we're like, oh, I want to check things more off. And like subconsciously, it's like, we go through our day and it's like hyper focus, hyper stress type of scenario to get as many things checked off, because that's when we get our dopamine hit, and most of us are addicted to dopamine. So, it's a real retraining, and I am working on this every day right now to try to retrain my body, because it really takes a daily practice to say, okay, well, how can we actually approach things differently from a state of like peace and relaxation without getting tasking done from this checking things off the list and overwhelm scenario.
Mm.
And in my personal experience, one of the best ways to monitor that and see how you're doing is through tracking HRV.
Okay.
And do you
Yeah.
think your listeners know what HRV is?
Yeah. Your heart rate
Yeah,
variability. Yeah.
yeah,
Yeah.
exactly.
Yeah.
Exactly.
Okay.
Yeah, it's
That's
a
good.
good way of working on overwhelm and seeing if like,
Mm.
okay, how is your body handling the stress throughout the day, and are you being effective at getting your tasks done in a way that is not so like neuroexcitatory, like so like turning your nerves on to a point where they're racing and that sort of thing. So it's
Mm.
a great way of tracking your progress to say, hey, how am I moving through the day without my internal subconscious state being in that overwhelm?
That's a good idea because we all need to work on that mindfulness to help us with the busy modern day lifestyles where we have so much coming at us all the time. And as you say,
Exactly.
I'm guilty of that myself, wanting to check off lists and feel good about what I've got done, you know.
Me too.
Um,
It's a daily practice.
yeah, yeah. So Dr. Diane, just I suppose, just to maybe tie everything up and coming back to the libido and relationships, and we
Mhm.
talked about communication earlier, but I suppose how might low libido affect emotional intimacy and communication within long-term relationships? And are there any strategies that you can recommend which couples can use to navigate that sort of sensitively?
Yeah, it's a really important thing. I'll throw another statistic out here for everybody, which is of couples that report being the happiest, like in all areas of their life, of their romantic life. They are having sex, they're being physically, sexually intimate about once a week. And so we do know that for a lot of people, there's this very big connection between their physical sexual intimacy and their relationship happiness. And within that, of course, emotions play a role, right? And one of the things that happens so commonly with emotions and with the emotional side of things is oftentimes things start out as like small little hits. And like one way to look at this is like, okay, well, goodness, I asked my partner to take the trash out, or I asked them to stop at the store and grab this thing for me and they forgot. Like these things that are really no big deal, but we don't voice them. We don't voice them in a kind way and just say, hey, like, let's just clear this air about this, like, so I can let it go. No big deal. And it's like they put just this little hole in our ship, right? In our love boat, you could say. And it's no big deal. It's a tiny little pinpoint, barely leaking at all. But, over weeks, over months, over years, all these little things. And then all of a sudden you have 100, 1,000, 10,000 of these little tiny, pinpoint holes in the love boat. Now you have a sinking ship. And so and what tends to happen that I think most people recognize very easily is that once there is enough of this emotional tension, it can be very, very difficult to move into intimacy and into that physical intimacy because, especially for women, but it can be true for men too, but especially for women, it's very, very common to need to feel extremely safe in order to experience physical intimacy. And not only to experience sexual intimacy because of safety, but also to achieve orgasms. And orgasms are really like we don't want to say chase the orgasm, but I do find that orgasms are incredibly important to keep people coming back. Like one thing that often happens in hetero relationships is that it's much easier typically for the man to orgasm. And with time, many times women, if they are able to orgasm, the orgasm starts getting less and less. Those emotions are built up. That lack of safety is there. And maybe her body's not being touched in a way that she needs, which is also very common and something I teach about. And all of these things all of a sudden lead her to not really having that great of a sexual experience. And she's not really that interested in doing that, if it's just like obligatory and it doesn't feel like it's providing anything for her. So it's kind of a long-winded way of saying like, oh, there's a lot happening here. It's like, when I'm talking about many different root causes, this is an example of there's many different things that are really tied into the sexual intimacy space. And you asked for like, what can they do from a solution standpoint? So one of the most important action steps is to begin to talk about it because like I said, the people that are successful here are talking about it. But what I encourage people not to do, and I really want everybody to hear this, is not to do what the tendency is, which is to start blurting out all the things that you don't like and you want to be different. So the action step I encourage people to do, the foundational step with beginning to talk about it, is just starting to name things that you really like about your intimate life. And if you're not having sex right now, name them about the way your partner hugs you, the way your partner kisses you, the way they cuddle you, the way they hold your hands, anything in that physical intimate space, right? And you want to be very, very specific, tend to be, specific about like exactly what you're noticing they're doing and then the impact it's having on you. So for example, if I say, "Oh, I love the way you kiss me, babe." Right? Like that's going to have a very different, just kind of like in passing versus like, "I love the way you grab my hips and you pull me in and you, tilt my head back and you kiss my neck and then you kiss my lips and oh, my body just tingles and I just feel so held and safe and supported in that moment." It's like when we're saying it like that, the partner, your partner is able to say like, "Oh, wow, this is powerful." And there's a couple of things that are happening when we're doing this. One, when we start to talk about the good things, sometimes the things that we don't like as much start falling away on their own because the more you talk about all the things you love, you're going to get more of them. And there's only so much time. So some of those things that are like, "Oh, I, don't like that as much," might fall away because you're just really emphasizing the good things. And two, the other thing that starts to happen is we're building the emotional sex communication love bank. So when research has been done by people like the Gottmans at the Gottman Institute on these kind of positive and negative things we say to each other, what they have found is the healthiest people, at least the last time I looked at their research, they said the healthiest couples, for every 5 good things, you need to at least say 5 good things for one that you want change. And that was a huge sign of couples that were really happy. And so, the same thing can apply to sex. And I would say, sex, the ego comes in so much that oftentimes it might be like 7, 8, or 9 things that we say are positive before we ever bring in that one that we need to change. And if we do need to change something, we want to say something. And of course, if something is happening where it's like you're making love and somebody is like actually causing like pain, say something right away, right? So there's always exceptions. But I'm talking more like the generals here. And so the point is that the foundational exercises start really building up that communication love bank. And from there, then once that is strong, like the idea is you want your partner to start to feel like, oh, when we talk about sex, it's safe. I walk away feeling like my partner cares about me. I walk around away and feeling like I'm providing a lot for my partner. I actually kind of like these conversations. We want to have enough of the good so like the nervous system's safe before we ever start to say like, hey, and this one thing, we do actually want to change it. So that's kind of that foundational step. And if people, want to know more, I always go through that in my courses as well.
Yeah, oh, that's great advice to begin communicating. And as I say, it is such an important part of our relationship in terms of intimacy, both emotional and physical. So that's really good advice. Um, are there, just to finish it off now, because I know obviously we need to let you go, are there any misconceptions about testosterone and sexual health in general, particularly for women, that you encounter in your clinical practice?
The biggest thing as far as testosterone myth is really just that testosterone is not that important, like we've
Mm,
covered, right? So that's the really big thing. But I think in a like kind of more general myth beyond testosterone is it is so interesting that we confuse in medicine and health the word common with the word normal. So it's
absolutely.
very right. So
Mm.
people will do, couples will, for example, like talk to their friends and be like, well, how often are you doing it? How often are you having sex? Oh, you're once a month, you're every quarter, you're once a year. And so because it's common that this part fades, people think it's normal. And normal is more around like, hey, am I in balance? Is my relationship in balance? Am I healthy? That's how I define normal. And so if we're saying that, hey, sex is supposed to fall, like the hotness is supposed to decline with age, it's supposed to decline with the length of the relationship, it really is common that happens, and unless we do something to step in and circumvent, then yes, it probably will, but it is not normal. Like we can actually, from a standpoint of like where relationships are healthy, as we see in surveys, healthy relationships still have hot intimacy, and that's still a part of it even 20, 30, 40, 50 years in. And so that's really what I like to dispel the myth of like, just because this is common doesn't mean this is like where that you are in the healthiest for your life and your relationship. And when we step in and we circumvent and we learn techniques and we learn how to talk about it and we learn to get back on the same page with any desire mismatch, for example, we can do a whole lot with really circumventing that and getting people back to being in love and having passion.
Fabulous. Dr. Diane, thank you so much for all of your expertise and insight. It was great talking to you.
Thank you so much for having me. And just to let everybody know, if you go to wanttowantit.com, you can find my book. And then you can go to libidoquiz.com to get that free quiz as well.
That's brilliant. And I'll put all the links in the show notes.
Thank you, Lynn.
My thanks again to Dr. Diane for sharing her time and expertise. Now, in this episode, we talked about testosterone, and since zinc plays an essential role in testosterone production, today's store cupboard staple is beef, especially grass-fed beef. Now, if you eat meat, this is one of the best sources of zinc that you can include in your diet. Other excellent sources are shellfish, poultry, egg yolks, and for plant-based options, pumpkin and sesame seeds are hard to beat. One of my early guests on the podcast was Brona O'Rourke from the Burn Farm, and I link her episode in the show notes because the Burn Farm is a wonderful example of the kind of farmers in Ireland we should support. People who really treat their animals with care, ensuring that they live good lives while producing leaner, healthier food for us. Now, grass-fed beef tends to be leaner than conventionally raised beef, but it's also packed with nutrients. It is one of the most efficient sources of zinc, which is also vital for immune function, wound healing, growth, and repair. Beef is rich in protein, iron, and vitamin B12. Now, some studies even show that grass-fed beef may contain higher levels of omega-3 fatty acids, vitamin E, and other antioxidants compared to grain-fed beef. So if you can choose grass-fed beef, you're not just getting a satisfying protein source. Remember, protein helps us to stay feeling full. We're also enjoying food that delivers a wide range of nutrients that our bodies rely on every day. So, how often should we eat beef? Well, lean cuts are generally the better choice, and the frequency really depends on your health and any advice from your doctor, which of course you should follow. But as a general guideline, enjoying beef once a week works well for most people. And of course, we can include other sources of zinc, the rest of the week. Now, the best way to highlight zinc and other nutrients in grass-fed beef is to pair it with vegetables and herbs and cook it either really quick, like in a stir fry, or slow cooked dishes. And a few ideas would be a grass-fed beef chili. So chili is really hearty because not only do we have the beef, but we have beans, and then there's tomatoes and greens and lots of other vegetables in there too. Stir fries, of course, are really quick and handy, and they're quite light but really nutritious. Usually we'd add something like peppers and courgettes and maybe carrots or bok choy to a stir fry. And of course, maybe some lovely anti inflammatory ginger as well. We could do grass fed beef lettuce wraps, which are perfect for a fresher, lighter meal or a lunch, and maybe add in some avocado and some herbs. Maybe some radishes, something like that. They're gorgeous with beef in a lettuce wrap. You could have also, of course, the classic stew. So this is really ideal for slow cooking. And with a stew, we tend to add more hearty vegetables, maybe like root vegetables, like obviously carrots and parsnips I would put in every time, and often some maybe turnip too. And you could always add in some courgette. And then add in some greens, some lovely herbs at the end when you're serving it. So I'll add a link to some recipes in the show notes, but hopefully there is enough information there to encourage you to add some more whole foods into your shopping trolley this week. Thank you for listening to today's episode. I just wanted to clarify that the podcast is for informational purposes only and does not substitute professional care from a doctor or trained health professional, nor constitute medical advice or services if you're in a position to need either. However, if you found it interesting, you can subscribe to make sure you don't miss future episodes, or sign up for my newsletter on lynsharkeynutrition.ie.